All right, so I'm going to give you an overview of the results of a systematic review that we conducted for caregivers looking at how physical activity interventions impact their lives, especially when they're involved in dyadic interventions, meaning when they participate with their care recipients. What's better for them? Is it better to exercise, or is it better to not exercise at all? Quick show of hands, how many people here are caregivers? How many people anticipate being a caregiver at some point in your lives or being on the receiving end of caregiving? Everybody in this room should raise their hands, right? Pretty important population, aren't we? There are 36 million family caregivers here in the United States. For those of us that are related to neurological disorders, 13 to 16 million, maybe a little bit more depending on the team, right? It is a very, very tough job. And so when it comes to caregivers, especially if you're a spousal caregiver or an older adult caregiver or a higher hour caregiver, your risks for poor health outcomes are pretty high. And when I say poor risk for poor health outcomes, hypertension, cardiovascular disease, depression, anxiety, and for some of us, dementia, right? And that's what we're here for, one of the topics, okay? So if a caregiver is not doing well health-wise, it's very hard for them to provide good care. And if they cannot provide good care, the cost of institutionalization go up dramatically, and it's very expensive in our country. So what can we do to help caregivers? Well, in our lab, we focus on exercise as a way to improve health. But for caregivers, the burden and the barriers to exercise are so steep. Right? So if you're already dealing with the burden of caregiving, and now what if you're a care recipient, you can't leave them? Can you exercise? Well, we'd like to make it possible in our lab, and we think that dyadic exercise interventions might be the key to that. And so again, when I say dyadic interventions, I'm talking about interventions that involve both the caregiver and the care recipient. For those of you that are super fond of the methods of systematic reviews, I've put our PRISMA document up there. But just to give you a little bit of a background, our question of interest was, do caregivers or will caregivers benefit from participation in dyadic exercise interventions if they're exercising together with their care recipients, or is it better for them to not exercise at all, maybe receive a separate intervention or usual care? So we were particularly interested in family caregivers and spousal caregivers. We excluded for caregivers that were children, adolescents, and also paid caregivers. We also very broadly defined the term dyad. So again, you could be exercising with your care recipient, or you could be enrolled as a dyad, but maybe you weren't participating in exercise. We started off with 10,000 studies. Half of those were cut because they were duplicates. But as we continued to whittle down through the screening process, we got to about 100 full-text articles. But the problem was that most of those were excluded because they didn't define who the caregivers were. They didn't include demographics on the caregivers, and they didn't measure pre- and post-test outcomes, right? You can't tell what happens if you don't know what those outcomes are before and after. So the bulk of them were eliminated. We got down to about 11 studies, okay? 11 studies. Of those 11 studies, 6 were studies that were geared toward the dyad exercising together. 5 studies, the care recipients were exercising while the caregivers received a different intervention or usual care. Those exercise interventions involve things like yoga, walking, tai chi, multimodal exercise, cycling at high intensity, as well as strength training. So it ran the gamut. For our population today, interestingly, 6 of the studies were based on dyads of dementia and Alzheimer's care folks. Kind of cool. All right, so these are the results. Again, I said there were 6 dyadic exercise interventions that were reviewed. Of those 6, the caregivers saw improvements to both psychosocial well-being as well as physical well-being. Let me describe. So psychosocial, depression, anxiety, burden. Physical, things like they improved their strength, they improved their functional capabilities, maybe they improved in heart rate and other measures related to their body or self-report. For those interventions in which the care recipients were exercising, but they were measuring the caregivers. If caregivers participated or were given another intervention, like support or education or planned respite, those caregivers were likely to improve in psychosocial well-being. And when I say planned respite, to give you an example, a couple of the studies actually went to the care recipient's house. They picked up the care recipients, took them to the intervention, brought them back. Caregivers had 8 to 20 hours per week of time to themselves. Okay, big deal, right? All right, so the limitations of the studies. I mentioned the limitations of those that were excluded. Obviously, there's a small number of studies that we covered with only 11. The quality of those studies ranged from fair to good on a Downs and Black checklist scale. Okay. The risk of bias was moderate to high. So the generalization is limited, but nonetheless, it shows us some really interesting things, right? We can accomplish dyadic interventions that involve caregivers. We can plan for them, but we need to do a better job at it, don't we? We need to have better controlled methodologies. We need to plan for it when the caregivers exercise. Are we controlling for how much they exercise versus how much they're helping out? Are we examining some of their interests and their concerns? And by that, are we thinking about the pathologies of the care recipients and the demands of the caregivers, right? They vary across diseases, or that's the expectation. So we need to do a better job at that. But ideally, we need to think about the fact that caregivers need to be included in these interventions. We can't keep overlooking them. And so if we're all going to be on the caregiving trajectory at some point in time, don't we want to be asked? Don't we want to be invited? And don't we want to be counted and measured? We do, right? The answer is yes. All right, so I just want to say thank you so much to my systematic review team. Wave your hand if you're here. Yes, awesome, and my amazing advisor, Dr. Kristen Pickett. I also want to say thank you to our research supporters who have provided the funding for us to do this systematic review, but also to the Asthana Family Alzheimer's Disease Memorial Fund, Dr. Benlin and Cheryl Spenceley, who made it possible for me to speak today. And thank you for listening.